What's happening in the field? How do you see it evolving, and where is it today?
I think we're on the cusp of a major change in the field. Our field has its roots in attempts to help patients for whom there was no other help. Giant aneurysms, difficult AVMs. We've progressed, and endovascular is now the mainstay of treatment for many cerebrovascular diseases. Obviously, it's been called the penicillin of modern medicine for stroke, but we're beginning to see that we may be able to treat chronic subdural hemorrhage. We're testing that very carefully, improvements in our science. There are early efforts to treat hydrocephalus, early efforts to treat paralysis, early efforts to understand what we can do in the cerebral vein, the venous system, as opposed to just the arteries. So I can't wait to see how fabulous this field's going to be when the people coming after us, the young people, are really able to do so much more than we're doing now.
So you're entering a stage of maturity, but that maturity requires data. Do you see the trials beginning to start supporting where you're going?
Absolutely. I mean, as I said, we started with diseases that were relatively rare, right? The incidence of subarachnoid hemorrhage is so low that you really can't do randomized controlled trials to look at every different possibility for aneurysm treatment. But we're beginning to get into disease states that are more common and more easy to gain that kind of serious evidence. And I think we're challenging each other. It's a multidisciplinary field, and colleagues that have come from different parent specialties bring different ideas, and the field is absolutely maturing where there's a greater degree of evidence-based conclusions and changes to what we know are the risks and benefits and alternatives for various disease states.
Does that touch only, that doesn't simply touch devices, it must touch also drugs? Is there an opening now in drugs and the way you use them?
You know, I think it's very early, but I expect improvements in therapy based on synergy between devices and drugs, absolutely. I was just looking at early work in opening the blood-brain barrier done at West Virginia University for treatment of Alzheimer's disease. Obviously, the vascular system is, in a way, the ideal highway to get to in very important and difficult areas in the brain. And so it's early days yet for pharmacotherapies that are neuroendovascularly delivered, but I agree with you that in the not too distant future that's going to provide us with some really interesting possibilities.
And in a more immediate sense, certain of the devices require more dual antiplatelet therapy. Is there a kind of understanding of how that will work with the way you're practicing today?
From my point of view, there's so much more that we don't understand than the understanding that we do have. But on the other hand, there's no question we're making major strides. As a neurosurgeon, I've often lamented the fact that we're not smart enough to be able to promote clotting in one area of the body and avoid it in a different area of the body. Sometimes I'm asked to do a craniotomy on someone who, for some reason, cardiac or otherwise, needs to be on antiplatelets. Obviously, that's very difficult. But with surface modification of flow diverters, we're starting to see efforts to modify or change systemic requirements for antiplatelet medications. We're starting to understand variabilities. Some of the early studies are all on, for instance, white men. And obviously, reactions to drugs are different in people who have different genetics, different ages, different backgrounds. So this is an area where we're learning a lot.
So I get the impression that the foundation is laid now, and now everything is sort of emerging from it and being built. So
I think your impression is correct. I think it's, if we have the opportunity at a much later date to sit older together and talk about what we've seen, I expect that point in the future, your retrospective musings will be very interesting, because I do think we're in an area of tremendous opportunity and growth for this field.